Hi, this is Dr. Ahadian. I'd like to discuss the relationship between the anger that has been built with regard to the frustrations experienced in the early childhood years and the relationship between that and the expectations and the point of view of the person towards the world. First, relationship with the anger built up in the childhood years. As far as the psychological aspect of frustration and non-achieving the goals and the satisfaction of what a child wants in his or her life in different stages of life with different ages are different. So basically the losses that could happen to a person in stages of life basically at the age of 2 years old would have a more severe ingrained psychological sequelae depending on whether these emotions are satisfied or not throughout the years than comparing to a loss happening at the age of 14 or 15 or more than that. So basically, first thing is that the destructiveness of the anger, which could cause with the relationship of the person towards the world, would be more intense. The more frustration and the losses and the consequence related dissatisfaction that the person gets from his or her life would be related to the intensity of the anger being more. At age of 3 to 5, the frustrations related in the losses and not being gratified with the needs are going to cause certain fixations at that stage, which is the anal stage, which is going to be a more kind of obsessive, restrictive kind of a expression and relationship towards the world, where we see less of an affect, more close tightness with regard to spending money, with expressive expression of the emotions, with being able to let go and less being open in the relationships. Now, all the aspect is a very big and very complex issue. However, this anger that is being expressed towards the world comes mostly with regard to how the parents or lack of the parents try to calm this explosive situation at the early age. So if we have parents who by themselves have problems with regard to their emotions and losses and going through depression and going through several other factors of losses, then we see more of a isolation between the parent and the child, and therefore the child beginning to get more frustrated and acting out, which then begins to express itself in multiplicity of factors related to alcohol and drug abuse, to sexual abuse and physical abuse and gang related issues. It's kind of like an overall picture that I wanted to begin discussing. Hopefully I'm going to discuss more in the future. Thank you.